wanted to start by saying that if there was a space this size in Lewisham, we would get excited because for us this is a large space. And we would start thinking about how many houses could we build on it and how many services could we reconfigure, because we have a borough of about 300,000 people and it's very densely populated. And we have a great deal of housing needs. So anything that we do in the name of devolution has to also fit with how do we make the best use of every bit of space and every kind of asset that we have in the borough as a whole, so that we actually address those wider determinants of health and developing for kind of well-being for our residents. So that's our first sort of call really in terms of devolution. So when it became a partnership between Lewisham Council and our health partners, it's not just me as a representative from social care, it's my colleagues. And I've worked more with my colleagues from regeneration and housing over the last few weeks than I have with my own staff in social care. And I think that's an important component of what we're doing. Devolution for us is about supporting the work of integration between health and social care in the main. We started that some time ago. It's quite simple. We're working with our acute providers as well as our community-based providers, and that includes SLAM, our mental health provider, and Lewisham Greenwich Trust. Our acute beds are all in the borough on one site. So what we did was the GPs were organised into 4 federations across the borough. We call them neighbourhoods. They're slightly larger than what we would normally see as a neighbourhood, but they're neighbourhoods for us. And they have now set themselves up into companies covering those areas. We worked with the voluntary sector to coordinate their preventative work in those neighbourhoods, and frankly, they've made a lot more progress than we have. We then looked at, okay, let's look at those staff who work in the community. So we worked with the Trust and with SLAM, and we put together virtually all of the staff. So the social workers, the physios, the occupational therapists, the district nurses, they all work in multidisciplinary teams. We thought we've cracked it. We've done it now, that's it. We've got integration sorted. We knew what we were trying to achieve, and I won't go through all of those because they've been rehearsed this afternoon. And then we realised that we still had the wrong people in the wrong place, sometimes doing the wrong things and certainly doing them at the wrong times. And that for us is now our challenge. So we have some form of integration, but how do we actually move it forward onto the next step? And there's kind of 3 parts of that. The first is when you don't know how to make the money work because everybody's short of it, and how do you actually take the risk and how do you take the plunge, you align the budgets. There's a lot that lies under that word align, and now we need to work out what exactly does that mean, and if we're going to move forward and put those budgets together in some formalised way, what will that mean? We don't really know what kind of model we are. We spent a day trying to work that out and decided that's too difficult. We'll put that on the too difficult to answer shelf for now, which is slightly groaning, but we'll come back to that. We'll just carry on doing practically what it is that we're trying to do. The other 2 big things for us are estates and workforce. Lots been said about estates. It is reconfiguring the services that we have on the hospital site, because some of them are not fit for purpose, some of them actually need to kind of be more out-facing with our local communities, and we're looking at ways that we might do that. But it's also about all the little kind of assets that we've got around the borough, some of which are community facilities with leaky roofs, some are GP surgeries, some are rooms that people hardly ever use, and other are spaces that actually need to be reconfigured. And so we're looking at how can we do that so we can accommodate our staff in our kind of neighbourhoods and they can work productively and work well together and be part of that local community. We're trying to get rid of the words coordinator and navigator. Because actually every time we get stuck, somebody says, oh, we need to employ a navigation manager or an integration manager, and that'll help. Actually, if you need people to help you navigate around it, we've probably got the system wrong. So we're starting again to stand back and say to our workforce, what is it that makes this not work? Why can't we really get the impact that we're looking for? So we're actually looking at different models, both here and in Europe, and trying to pull those together and get them to work with us to actually have a much more coordinated workforce with much kind of better defined roles and kind of flexibility between roles. So that's the sort of basis of our pilot, and we look forward to developing it further and working with other colleagues across London.